Okay, good evening, everyone. Welcome to tonight's presentation, What is Dementia? A few things before we begin. If you would please type your questions in the Q&A box. We'll kind of hold off on them until later in the presentation and ask our presenter to address them. So what is dementia? To tell us all about this tonight is our speaker, Aishling Dalton Kelly. Aishling is a certified dementia practitioner and is CEO of Aishling Companion Home Care. We're so pleased to have Aishling here to share her expertise and the education she regularly provides to caregivers and healthcare professionals. So at this point, I will turn the evening over to you, Aishling.
Wonderful. Thank you so much, Mary Lynn, and happy Friday to everybody that's listening in this evening. I hope that you're comfortable and warm, and I'm delighted to be able to bring this presentation to you, courtesy of the library. For those of you that did not tune in last week, this is the second in a series of 6 that we're going to do that really highlight and educate and will help families that are going through the journey of a form of dementia with a loved one. As Mary Lynn said, my name is Aishling. A little disclaimer, I'm not a nurse and I'm not a doctor. I'm simply a layperson, possibly like many of you listening, who's been through this journey with a loved one and didn't know everything that I'm going to teach you this evening, which is really very important, that you have the basics to help you understand really what's going on. And for those that, again, were not on last week, you can review everything on the YouTube channel from the Orland Park Library. And tonight we're going to build on what we talked about last week. And last week was really the basics of how the brain works and how it doesn't work when a form of dementia basically invades the brain. So tonight we're going to talk about a topic that is what actually is dementia. And if you look at the little graphic that I have put up there for you, we're going to put all the puzzle pieces together so that you understand the most important components of dealing with a loved one with dementia. So what exactly is dementia? Well, tonight, I hope that when we leave here, everybody will understand what dementia is, its possible causes. I certainly hope that you'll be able to understand the different types of dementias and their characteristics. And we're going to go through several of them, but mostly the most popular ones. And then I'm going to teach you the basic medications that are frequently used and their possible side effects. So let's talk about this word Alzheimer's, because we hear it all the time when we talk about dementia. So where did it actually get its name? Well, it actually got its name from the person who found it first, and that was Dr. Alois Alzheimer. And in 1906, he noticed changes in the brain structure of a woman who had died of an unusual mental illness. And when they did the autopsy on this woman's brain afterwards, this is what he discovered. Now, tonight we're going to talk about most specifically 5 or 6 of the most prevalent forms of dementia, but there are actually over 400 different types of dementia, the most common types being Alzheimer's and vascular dementia. Dementia is very likely to develop in people over 65, but it can actually also develop in people younger than 65. And we're going to address that here in a little bit also. So this visual is probably the best piece of this whole entire presentation this evening, because so many people don't understand dementia, Alzheimer's, all of these other different names. So the best way that I can showcase this to you is to explain to you that dementia is really a very broad term. It's an umbrella term. And then if you look at the little people underneath the umbrella, you will see that we have Alzheimer's, vascular, Lewy bodies, and frontotemporal. And I'm going to explain why they're there in a few minutes. And you can see the little percentages Don't worry about reading, those and retaining that information now, because I have this diagram repetitively through the presentation so that you will understand where I'm going with this. So let's look at the most prevalent forms of dementia. I did say that there was over 400, but we're just going to speak tonight about the most popular ones. And really, it will really be about Alzheimer's in general. But if you look here on the list, you'll see that we have Alzheimer's, vascular. We have a dementia that's called Lewy bodies. We have a Parkinson's type dementia. We have a frontotemporal, what's known as CJD, Creutzfeldt-Jakob disease. Then you have the Wernicke-Korsakoff syndrome. We have mixed dementias, normal pressure hydrocephalus, and Huntington's disease. That's a lot for you to take in, but you don't have to memorize all of them. Now, before I break down the difference in the different types of dementias, I want you to understand that there are actually dementias that are pseudo-dementias. And if you look at the word pseudo, basically mean fake or not real, that's exactly what a pseudo-dementia is. It is a collection of things that present as dementia, but it's not dementia. And one of the pseudo-dementias that I can think of right off the bat is something as simple as a UTI, which is a urinary tract infection, can present as if a person suddenly has a form of dementia based on their behaviors, dizziness, change in personality, and all sorts of other stuff. We're going to talk a little bit about that as we move forward here as well. But a pseudo-dementia is really a condition that appears to be very similar to dementia, but it doesn't have the root in its neurological degeneration in the brain. So what are the main symptoms of a pseudo-dementia? Well, a person can have a problem with their speech. They can have a sudden loss of memory. They may have difficulty paying attention, difficulty regulating their emotions and keeping themselves under control, difficulty organizing. There's the UTI that we talked about. There can be sensory loss and nutritional deficits like electrolytes imbalances and things of that nature. Sometimes when you see where it says sensory loss there, I'm talking about if a senior, for example, cannot see properly and can't hear properly, they respond the wrong way because they're hearing the information coming in the wrong way and they're not seeing things as they really are. Sometimes that can present as a pseudo-dementia. So as I had said earlier, everybody thinks that dementia is an older person's disease, and for the most part it is, but there's about 9% of cases that are under the age of 65. So what is the typical life expectancy for somebody that has dementia? Well, it can go from 0 to 20 years. Generally speaking, when it is diagnosed, the average person will live around 10 years after that. In other words, a person can have dementia for probably 4 or 5 years before it's actually diagnosed. However, this most certainly can vary significantly between individuals, some people living for more than 20 years. And I don't know if any of you are familiar with Sandra Day O'Connor. She was a Supreme Court Justice Judge, and her husband actually had dementia for slightly over 20 years. For some people, dementia progresses much quicker than others, and there's reasons for that based on the underlying causes. This picture here, I love this graphic because it gives an idea of what's happening over what time. And we, I suppose, don't really know how many defined stages there are, but we do know for sure that there are 3 stages. So I want you to think about when you read a story to your children or when you go to see a play in the theater, there's always the introduction, there's the meat and potatoes, so to speak, of the story, and then there's the finale. The same is true of dementia. Now, recently, there are other doctors who have come up with 7 stages, and I recently read that there's now 9. The reality is I just don't want you to get overwhelmed, and I want you just to remember really that there is 3 stages, and none of these stages are like night and day where you go from one stage to the other. It happens over time, somewhere between that 0 and 20 years or 0 and 10 years. So we have the mild stage, which is early, the moderate, which is the middle stage, and the severe, which is the late stage. And that's as simple as it is, and that's all that you need to remember. So last week we had some people ask us, if you forget your keys or your wallet or your memory isn't as sharp, do you have dementia? Well, I'm not a doctor, but what I will share with you is that there is normal aging symptoms, and then there's those that are different, the 10 signs of dementia. In this slide here, we talk about the normal aging symptoms. So normal aging is, when a person may be slower to recall events or forget part of a story. You can still speak and you can follow written directions and instructions. You may sometimes, have a little bit of a challenge concentrating, but you're able to absorb information and your capacity for the most part stays intact and good. That's all normal aging. Here, we're going to talk about what the actual classification of dementia is. Now, again, I put this umbrella here for you because this is the easiest way for me to show you a visual of everything that's going on at the same time. So if you look at the umbrella, again, think of dementia. And when you have a form of dementia, all these things underneath the umbrella are all going on at the same time in the brain, causing deficits. So dementia is a collection of symptoms. It can be mild or it can be major. And it includes the loss of your mental function, which causes obviously a decrease in your memory. It also causes deficits in your judgment, your orientation, your learning, and your language. Now, if you look here at this little chart that I've put here, these are some of the things that you may see in a person over time. Again, you're not going to notice these in 24 hours. A person's, personality starts to change. Their memory isn't as sharp as it used to be. They're not very good at putting their words together, or they're having difficulty forming the words. Their thought process isn't good. Their navigational skills are not good, and their behavior starts to change. This is the classic 10 signs of dementia: the short-term memory, the difficulty finding the words, changes in mood. Apathy is really a lack of luster, similar to depression, but really just no interest in anything. Difficulty completing normal tasks that you were once familiar with, confusion, difficulty following storylines, false sense of direction, repetitive behavior, and struggling to adapt to change. Now, we're back to this umbrella again because I had said that there's over 400 different types of dementia. For the purpose of what we're learning tonight and time, we're really going to focus on about 5 or 6. So dementia, as I said earlier, is an umbrella term. Now, if you look where I put the Alzheimer's underneath the umbrella, that is to signify that Alzheimer's is the most prevalent type of dementia. So let's look at it this way. If you are diagnosed with Alzheimer's, you have Alzheimer's dementia. However, if you have a form of dementia, it does not mean you have Alzheimer's. So let me say that again. Alzheimer's is a form of dementia. If you have Alzheimer's, you have dementia. If you have dementia, it doesn't necessarily mean you have Alzheimer's dementia, because you can fall into any one of these other dementia categories that you see under the umbrella. There you go. That's the little diagram that I had for you earlier. If you look now at the brown guy, Alzheimer's diagnosis is generally the most common that's diagnosed. It's between 50 and 75% of most of the diagnoses of dementia. Vascular dementia falls between 20 to 30%. Then you have Lewy bodies, 10 to 25%. And then you have frontotemporal is 10 to 15%. They are the most popular types of dementia basically that's diagnosed. So now we get to this very confusing, well, is it Alzheimer's or is it dementia? I hear this all the time at my support groups. People get confused, they get hung up on it. So here's the clarification for you. Dementia is a very general term for a decline in mental ability severe enough to interfere with daily life. Alzheimer's is the most common of these dementias. Alzheimer's is a very specific disease. So what are the actual characteristics of Alzheimer's disease? Now, as I roll through these slides, you'll see that in most of the dementias that are underneath that umbrella, many of these characteristics are the same. So we know that there's an increase in loss and confusion. We know there's the inability to learn new things and hold on to that information. We already said that there's difficulty with language, problems with reading and writing and working with numbers. You'll see this many times when people don't want to read anymore. They're not very good at signing their signature. They can't balance their checkbook. There's difficulty organizing their thoughts and thinking logically. There's a very short attention span. They don't particularly like new situations or being around a lot of people at any one time. They have difficulty carrying out multi-step tasks, such as getting dressed, because there's so many different pieces to that. And just as a little tip, if you are ever dealing with anybody that has a form of dementia, you only give them 2 choices, not 3 or 4 or 5, just 2. It's either or. They also have a problem recognizing their family and their friends. This doesn't always happen in the beginning. Like I said, when it's the very early stages, this is more towards the middle stage, and certainly at the end stage of dementia, sadly, they do not know anybody. There's hallucinations, delusions, and paranoia with most dementias. There's impulsive behavior, such as undressing in inappropriate places or possibly using vulgar language, inappropriate outbursts of anger, and sadly, there's restlessness, agitation, anxiety, tearfulness, and wandering, even in the late afternoon or evening, and that is sundowning. I'm sure you've heard of that term before. And there's also repetitive statements or movement, and sometimes muscle twitches. Now, they're just characteristics of that Alzheimer's disease. Now, for anybody that's listening tonight that was listening last week when we went through the brain, this is basically what we did. We drilled down as to exactly what is happening in the brain of somebody that has Alzheimer's. And just to recap, if you look on the left, you'll see your normal neuron with those octopus-like dendrites around the side. You'll see the green piece in the middle, which is the cell. That's healthy. That's a healthy, normal neuron, and your brain has gazillions and billions and trillions of these. However, when you have a form of Alzheimer's, there's formations of plaques and tangles, most specifically amyloid plaques, and they start to clump around and inside the neuron. And eventually these clumps get more and more numerous. They join together and they really block off the signaling all around your brain in different areas of your brain. And that causes all of the deficits in the 5 areas that we had talked about a few minutes ago. So we also know that the most common gene associated with the late onset of Alzheimer's is that Apollo protein, which is E-APO. Now, we're going to talk again about this diagram because we've discussed what the Alzheimer's dementia is, which is the one that is most commonly diagnosed by doctors. And then the next one is the green guy that we see here. And we're going to talk a little bit about vascular dementia. So vascular dementia is a term that describes problems with reasoning, planning, judgment, memory, and other thought processes caused by brain damage from impaired blood flow to your brain. So a lot of people that have strokes, or we'll say hemorrhages in the brains or traumatic brain injuries, many times can get vascular dementia afterwards. Here are some of the characteristics of vascular dementia. And you'll see here that many of these characteristics are very similar to the ones that we saw with those that had a form of Alzheimer's. There's a lot of restlessness and agitation, an unsteady gait, which is a very unsteady walking and on your feet. And then there's the sudden or frequent urge to urinate or the inability to control passing urine. And then you have the depression or the apathy as well. So many of these characteristics mirror what we already saw in the dementia diagnoses. Now let's talk a little bit about the Lewy bodies. Now, I don't know if anybody listening remembers the actor Robin Williams. Robin Williams was a very, very popular comedian. He was most probably famous for that movie, Mrs. Doubtfire, which I personally loved, was a favorite in this house with my kids. Well, Robin Williams, if you remember, committed suicide. That's how he passed away. And what a lot of people don't know about Robin Williams is that he had been diagnosed with a Lewy bodies form of dementia. In my opinion, I think that all of these diseases are terrible, but I definitely think that some of the things that happen with Lewy bodies, it's a very aggressive type of dementia. There's a lot of hallucinations and paranoia. And it's a very, very difficult type of dementia to take care of, especially without having good support system. So he had this particular type of dementia. It's otherwise known as LBD, and it is associated with abnormal deposits of the protein that's called alpha-synuclein in the brain. These deposits are called Lewy bodies, and they affect chemicals in the brain who change in turn can lead to problems with thinking, movement, behavior, and mood. Again, there's some crossover here, again, changing in thinking and reasoning. We saw that in the other two as well. Confusion and alertness that vary significantly from one time of day to another or from one day to the next. There you have the slow gait and imbalance. We had seen that previously as well. With the vascular dementia, there's some other Parkinsonian movement features. We're going to talk in a few minutes about Parkinson's dementia. This is probably a big definer here is the well-formed visual hallucinations. So people that have the Lewy bodies dementia do have very bad hallucinations. And not only is it very frightening for the person who has the disease, it's also very frightening for the person who's taking care of them because it is a sensory perception and they really can describe in great detail what they're seeing and also how frightened and anxious they become with these hallucinations. So they have trouble interpreting visual information, sleep disturbances, and then the malfunction of the autonomic nervous system too. Here's our little umbrella again. And now we're going to talk a little bit about frontotemporal dementia. So this is like the last one of, we'll say, the most popular dementias. And for folks who weren't on last week as well, we did talk about the different lobes in the brain, temporal lobe being one of them, and a frontal temporal is kind of highlighted there in the picture of the brain that I have for you on the right. And this is the area of the brain that is affected. So the frontotemporal dementia is an umbrella term for a group of uncommon brain disorders that primarily affect the frontal and temporal lobes of the brain. These areas of the brain are generally associated with personality, behavior, and language. And in the frontotemporal dementia, portions of these lobes shrink or atrophy. So they start to basically die off. And I have heard many people, again, in my support groups say that their loved one has frontotemporal dementia, and they tell me that their personalities changed very rapidly over a little bit of time. And of course, then they had a formal diagnosis done because they knew what was happening, wasn't normal, and their personality changed so dramatically that they had them tested. And they were in actual fact diagnosed with frontotemporal dementia. Now, this little umbrella is a little bit different to the one that you saw already, because on the previous one, I showed you Alzheimer's, I showed you vascular, I showed you Lewy bodies, and I showed you frontotemporal. So we're now going to talk very briefly about some other common types of dementias. But don't panic, I'm not going to go through all 400 of them. So let's talk a little bit about Parkinson's disease dementia. So Parkinson's disease dementia is a decline in thinking and reasoning that develops in many people that have already been living with Parkinson's for at least a year. And they develop Parkinson's dementia. Now, if you don't know what Parkinson's dementia is, or how would you relate to it, if you can think back of the very famous boxer Muhammad Ali, he actually had Parkinson's, and then obviously that went into Parkinson's dementia. There is the visual hallucinations in this disease, as we had seen also in the Lewy bodies. There are delusions, there is depression, irritability and anxiety, and then you have sleep disturbances, including excessive daytime drowsiness and what they call REM, which is rapid eye movement sleep disorder. Now, you probably have never heard of this one. It's called Creutzfeldt-Jacobs disease, otherwise known as CJD, because it's got a very long title. This is a very, very rare condition that affects the brain, and it causes brain damage that worsens rapidly over time. Characteristics of CJD are, again, the loss of intellect and memory, changes in personality, loss of balance and coordination, very slurred speech, vision problems and blindness, abnormal jerking movements, and a progressive loss of brain function and mobility. Then I'm sure many of you have heard of CTE. It's called chronic traumatic encephalopathy. And this, if you look at the two diagrams that I have here for you, you can see the normal brain, and then you can see the advanced CTE. And last week, we had diagrams of a normal brain and obviously a brain that had Alzheimer's. And what we know is that in the brains of folks that do have forms of dementia, the brain obviously shrinks over time, and very large gaps, such as the one that you see here in the advanced CTE, which means that if you look at that gap up there around the 12 o'clock position on the right-hand side, the messages can't get from one area of the brain to the other because of the shrinkage and because of everything that's going on. A progressive CTE is a progressive fatal brain disease, and it's associated with traumatic brain injuries, including concussions and repeated blows to the head. It's also associated with the development of dementia. Now, for any sports fans that are listening, there is a lot of talk about CTE in our football players and in our military and in our folks that are boxers, baseball players, anybody that gets a lot of concussions. There's a lot of talk about this CTE and how bad concussions can be for you in later life. We have the TBIs as well, which comes from bomb blasts from our military. You often hear of some of our military that come back and they're just not the same. Their wives or their children or families will say they're shell shocked. They're just not the same. That can be part of this related traumatic brain injury from bomb blasts that they have experienced when at war. The TBI is a progressive and fatal brain disease associated with, again, the repetitive traumatic brain injuries, including the constant concussions and repeated blows to the head. This too is associated with the possible development of dementia later on in life. So now let's talk a little bit about some of the medicines. So we have donezepam, which is otherwise known as Aricept. We have galantamine, which is otherwise known as Razidine ER and Remeron. And then you have rivastigmine, which is Exelon. These are typically the medications that are used with many of the forms of dementias. Now, sadly, with development of all these medicines, it cures one problem, but sadly can cause another. And if you look at this chart here and you go down under the Aricept and you go down under the galantamine and the Exelon, you'll see that many of the same symptoms carry through all three of these medications, most especially the diarrhea or the loss of appetite. Some have weight loss, others have heartburn. You see a lot of drowsiness and dizziness. And then some of them, for example, in the Razidine, there's extreme tiredness. So for those that don't know that we are now part of Dementia Friendly America, Orland Park is now a dementia friendly village. When we got together with our task force, our police and our first responders asked our pharmacist if he could come up with a general list of medications that are used for people that have a form of dementia. And we had a pharmacist actually on the task force who came up with this list. This is exactly the card that our first responders have in their wallets. And it's also on the central database for the police and the first responders to see. And the reason that they wanted to know these pills is because whatever about our first responders knowing a lot about medication, police department isn't necessarily medically minded, and they're seeing a lot of people that they think have a form of dementia, but they don't know because the person can't tell them that they have it. They may not have a family member with them that can advocate for them. So they sometimes look at the medications that are in and around the house, or they look at a list, if there is one, on the refrigerator. So now in their wallets, or as I said, in their computer database, they'll have these lists that you see here tonight. And this is the one that we created specifically for our first responders here in Orland Park. So there you'll see the names of pretty much the medicines that are used in general for treating dementias. So now let's look at some facts that you may not be aware of as we talk about all of these different types of dementias and Alzheimer's. We currently have here in the United States more than 5 million people that are living with the Alzheimer's form of dementia. And sadly, it is a non-discriminatory disease. In other words, it affects everybody, whether you're white, brown, or black. It doesn't matter what part of the world you come from, it knows no boundaries. And if you look here, this clock demonstrates that every 63 seconds, we have somebody that has a form of dementia. And of course, my little diagram got stuck there, but let's see if I can get my clock to do what I want it to do for you. There we go. So every 3 seconds, which is astounding as you see the world turn. Every 3 seconds, somebody is diagnosed in the world with the form of Alzheimer's. So that's pretty scary. Every 63 seconds here in the United States and every 3 seconds globally. So here's another statistic for you. Here is the top 3 countries with the highest rate of diagnoses. Finland being number 1, The United States is second, and then we have Canada at number 3. And the lowest rates of diagnosis with this disease is Singapore, Fuji, and Kuwait. We currently spend 290 billion of annual costs, and Alzheimer's is the 6th leading cause of death. So think about all of the people you know that have had breast cancer and passed away from it. Think of all of the people that have had colon cancer and have passed away from it. Both of those combined, Alzheimer's beats it out. Now, what's a very interesting fact is that 2/3 of the diagnoses are women. Now, I have no idea why that is. I wish that we were all in a room in person and I would go around the room and ask all of you why you think that is. I have my own thoughts why I think it is, but it's a very interesting fact that 2/3 of the diagnoses are women and only 1/3 are men. All right, so now let's look again at our umbrella. I told you that dementia is an umbrella term. Underneath that, at the top, we have our Alzheimer's disease, which carries 50 to 65% of the diagnoses. Then we have your vascular, your frontal, your Lewy bodies, and then all the other ones that I shared with you. So let's recap. Dementia is a syndrome in which there is a deterioration in all different parts of the brain at the same time, which affect your memory, your behavior, your ability to perform activities of daily living, and your behavior. Alzheimer's dementia was named after Dr. Alois Alzheimer because he was the one that discovered it back in 1906. We know, think about Robin Williams with Lewy bodies dementia, is the disease that is associated with the abnormal deposits of protein called alpha-synuclein in the brain. Vascular dementia is the general term that describes problems with reasoning, planning, and judgment. It really, I want you to think about this one, is the impaired blood flow to your brain. So again, think about somebody who's had a stroke or a brain bleed or something of that nature. That's where vascular dementia comes in. You have Parkinson's disease dementia. Again, think about Muhammad Ali. It's the boxer, a decline of thinking and reasoning that develops in many people living with Parkinson's. And then we have the CJD, which I told you was the extremely rare but fatal condition that affects the brain. If you remember, I showed you the 2 pictures, and the CJD, the brain was extremely shrunk, making it incredibly difficult for any sort of messaging to get through. It's a very, very, very rare and fatal condition. And then we talked a little bit about frontotemporal dementia that affects the frontal temporal lobe. So if you were to touch your forehead, what's behind your forehead, that is the frontal temporal area of your brain. And frontal temporal is an umbrella term for a group of uncommon brain disorders that primarily affect frontal and temporal lobes of the brain. We also know that medicines used for dementia typically are donepezil, galantamine, and rivastamine. And we also know, as I had said to you when we started out, that it isn't always an older person's disease. Many people think that you have to be in your 80s, 85 to get it, while most people over the 85 do have it, and certainly will have it as the numbers increase with the baby boomer generation. There are 9% of cases of diagnoses of dementia for folks that are under the age of 65. There is a little visual for you. There we have Alzheimer's, vascular, frontal temporal, and dementia with Lewy bodies. And then the little black area, the 11.6%, that would be the dementias like Parkinsonians dementia, the CJD, and the other ones that we mentioned that aren't as prevalent as the previous 4. So now I hope in concluding here tonight that you do understand what dementia is and its possible causes. We did learn the difference between the types of different dementias and some of their characteristics. We know that the names of the general medications that are used for treatments for forms of dementia, and we also understand many of the side effects when we looked at all the different medications that are used. Now, I put this diagram in here for everybody tonight because this diagram is really important. Now, again, if I had everybody in a room tonight and was presenting live, I would ask you all, what do you see when you see this picture? So clearly we see an older man on the right, and clearly we see a younger man on the left, and they're both dressed the same. But if I were to show you this picture, what do you see? Aside from seeing two women in the picture, and the previous picture had two men, what I'm trying to give you a visual of is what happens when a person has any of those forms of dementia that we spoke about earlier. And that is that when a person has dementia, their brain is shrinking. So in essence, their short-term memory disappears. So you look at this lady who's looking in the mirror. She does not recognize herself as being an old lady. Her memory has gone way back in time, and she recognizes herself as a young woman. And where this sometimes is very prevalent is many times, and oftentimes you'll hear folks that have dementia saying, I want to go home. And you'll hear the daughter and the son saying, but you are home. But to them, they're not, because going home to somebody who has a form of dementia, they're talking about potentially a feeling of security that they had when they were younger, and they don't recognize themselves that they are older. So if we go back to this gentleman here, again, if there was a mirror in the middle, when this old man looks at himself in the mirror, he doesn't see an old man. He sees a younger person. And again, you may have heard people, a couple say married for 30, 40, 50 years, and the husband will say, my wife doesn't even remember that I'm her husband. And that is why, because the memories of everything that has transpired disappear, sadly, over time, and a person's brain reverts back to their younger days. And in saying that, that does not mean that you ever treat anybody that has a form of dementia like a baby. You don't talk down to them or treat them like a baby, but you certainly do have to provide care to them that would be as gentle and as loving as if you were supplying that care to your child, because they have lost the ability to remember things and to be safe. And that's, again, many times when people go out, they get lost in their own neighborhood because they don't know their way back. So last week we had a couple of people on. I don't know if Terry's on again this evening, but she had asked for activities. What do you do with a person all day, every day that has middle stage dementia or late stage dementia? The days are incredibly long, and how do you keep them occupied? So one of the presentations that we're going to be doing later on in this series is a whole entire presentation on activities of daily living. But I just wanted to address Terry's questions from last week to say that here are some of the things that you can do. People that have a form of dementia, whilst I just said you're never going to treat them like a baby, you have to give them very, very simple tasks. I had said earlier, 1 or 2 choices, no more than that. And that is because they can't make decisions by themselves. So you want to help them to feel better and to feel independent and to feel like a human being. So folding towels is a very good exercise because people that have dementia always want to be doing something with their fingers. You can most definitely create memory boxes, threading pasta through yarn, or even cutting up some old family magazines and calendar pictures that you like. It doesn't even matter if they don't have any family, we'll say, pictures in their life. Just the cutting and the doing and saving of pictures, maybe of flowers, is something that's very pleasing to a person that has a form of dementia. You could also, if they're able, do some cooking and baking. You can certainly use music, has wonderful effects on people that have dementia. Again, more specifically in stage 2, heading into stage 3. You can certainly build container gardens and indoor gardens as well. What I had said last week to many folks that were on the presentation is there isn't a one size fits everybody. You have to look at who this person was before they had dementia, because in actual fact, they're still that person. Their likes and their dislikes do not go away just because they have a form of dementia. So the activities that you would do with them would have to be something that they had an interest in. So for example, if you had, well, say your dad has this disease and he used to like working with woodwork and building things, you know, the same would be true with dementia, only that you would have to take it down many levels so that it would be simple. But he could possibly help you build boxes or little cabins and things of that nature that make him feel like he's still doing woodwork, if that makes sense. Then last week, we also had Jackie was asking, not sure if she's on tonight again, you know, what are some new treatments that they're looking at? Are there any medicines that they're finding that work? And she also wanted to know, is there any medicines that reverse the faulty connections in the brain? So I wasn't able to find, Jackie, if you're on any medicine that can do that, sadly. What I did find is what I have here on the screen for you. And that is that they are using jelly drops. It's an exciting new invention to help combat dehydration in dementia. And the jelly drops are nice and small, so people don't choke on them, which is good, whereas they may on a regular hard candy. There's some new blood tests out there that they're looking at to diagnose Alzheimer's disease. I've talked about this when I was training all of the first responders here in Orland Park, and I asked many of them, would you actually go and get that test at 40? They say that dementia begins years before it ever shows or presents when it's in their 70s or 80s. They say that it's in your 60s or your 50s is when the dementia first started. So the question then became, would you actually go and have that blood test done in your 40s that would tell you that potentially you may get it? I don't know that I would. Some people said yes, and other people said no way. Then we have a new gene therapy to tackle inherited forms of dementia. They are taking the reduction of dementia risk a step further. There are some sensory impairments in older adults they're finding out that can increase risk. And then I had talked about the research that's going on now as to why 2/3 of the folks who get it are women and only 1/3 is men. So they're looking extensively into that. And then I did mention last week that there's great work going on with this hyperbaric oxygen with people called HBOT. I mentioned last week Dr. Daniel Amen, America's #1 neurologist, and I know that he's done some fabulous work with that as well. So that's just the stuff that I was able to find that I wanted to follow up with for those that were listening last week. So now, Mary Lynn, I can't see the chat box, but if we have any questions, maybe you could read them out and I'll see if I can answer them.
Yes, hi, thank you, Aishling. We've got some questions in the Q&A. One is from Jackie. Does the type of dementia totally determine the treatment, as it seems difficult to get doctors to pin down or figure out the type?
Well, Jackie, that's a loaded question. And as I said, I'm not a doctor and I'm not a nurse, but I'll certainly try and help you with the answer of that. So first off, Alzheimer's cannot be diagnosed 100% unless a person's dead. And yes, I said that the person has to be dead in order for them to do an autopsy to actually say that it was specifically Alzheimer's that the person died of. Now, the reason that most people are diagnosed with Alzheimer's in general is because with the characteristics of Alzheimer's, when you go into a doctor and you tell them all these things that are going on, typically that's what doctors will say, you know, that we believe that it's this form of Alzheimer's. So you can't really get that definitive diagnosis unless, as I said, the person has passed away. And then the other piece of that is that, like I said to you with Robin Williams, his behavior changed significantly, where these hallucinations, the paranoia, the depression, a lot of other things were going on. And he did actually go and get diagnosed from all of the neurologists, and they did all of the workups, the CT scans, the PET scans, the blood work, all of that. And he was diagnosed as having that. So many folks, Jackie, do not have, they don't have the money to be able to chase this down to the end to where they can actually get a definitive answer unless there's very dominant and obvious, we'll say, markers that they're looking at, like in this case with Robin Williams. So I hope that answers your question in as much as I can answer it for you.
Okay, thanks, Aishling. That answered one of Victor's questions. So another one from Victor was, are the more extreme symptoms that show up toward the bottom of the Alzheimer's list definitely going to affect everyone with the disease, or do they occur randomly relative to each individual's case?
No. So those ones, Victor, that you saw, is he talking about when I showed that diagram of the different types of dementias? Is that what he was talking about? Let me go back just so I can get clarity. Is he talking about these ones on the bottom?
The list of
things that happen.
Of things that happen.
That one. No, go back. Oh, no, not that one.
The characteristics you're talking about of Alzheimer's?
Yeah. Yeah.
Let's go back.
Characteristics?
That one.
Here?
Yes.
Yes.
Okay, so now I'm sorry, Victor, what was your question?
As you get towards the bottom.
As you get
worse
towards
symptoms.
the bottom, which he thinks sound like the worst symptoms or characteristics, will they happen or affect everyone with the disease?
Yes.
Or do they occur
yes.
randomly?
So the ones at the bottom, Victor, don't happen in stage 3, just because they're at the bottom of the list here. These are just a general list of all the things that can happen to people through their journey. So the restlessness, and we'll say agitation and anxiety and tearfulness, you'll see that maybe at the end of stage 1. It'll still be there in stage 3, and it'll definitely be there in stage 2. So yes, all of these are all the way through when you're having dementia. It's not just at the end.
Okay, and I just got a note that my colleague Sarah said she would answer that question of Victor's also live. Did you have something to add, Sarah?
Oh, no, I'm just checking them off as they're answered so that we know where we're at in the list of questions.
Oh, okay. I'm sorry. I misread the note there.
Just trying to help you out.
Okay, thank you.
Welcome.
We also have Jackie made a note. She said, I saw those in the UK. And I think Jackie was perhaps referring to the jelly.
Oh, the jelly beans or the jelly tots.
Is that correct, Jackie? Yes. So she was just noting that she saw those in the UK.
Yeah, they're also called here in the United States a comfort measure. So if you had somebody who had a form of dementia, many times they pace or they shadow the caregiver or their spouse or whoever the family member is. They get restless and antsy. So you use a comfort measure, and a candy that a person wouldn't choke on could be a comfort measure. Also a blanket or a little fidget digit, something that they like to hold in their hand that kind of distracts them from their anxiousness. It's called a comfort measure. And a jelly tot that I had mentioned earlier, that's what's considered a comfort measure to calm somebody down.
Okay. And then Jackie says, I might have a medication to share with you.
Okay. For Alzheimer's disease, is she talking about?
And Jackie, could you perhaps put that in the chat?
Is it a newer medication that's on the market?
She put it in the Q&A. She's saying Remeron.
Remeron. Yes, I have heard of that one.
Okay. All right. Sorry, I'm having to go back up. From Jay Shoemaker, for information, is there a good central location to go to?
Well, it really depends. The Alzheimer's Association has a great website. It has lots of great information on there. The Dementia Friendly America.org is another website. That's dfamerica.org. But Jay, it really depends on what sort of information you're looking for. And if I kind of was able to drill down a little bit, I might be able to help you, but it depends. It depends what sort of information you're looking for. There's all sorts of information out there. You just need to know where to be able to obtain it. I would say the Alzheimer's Association website would definitely be a great place to start. And certainly if you couldn't find what you're looking for there, they have a 1-800 number, and you certainly can reach out to them. And for anybody that's listening, I think one of the saddest things that I hear over and over and over again in my support group, which I've been doing for 7 years, is that people that are at the end of their tether, the end of their rope, the cognitively fine caregivers that are dealing with their loved one who has this, they're not aware that there is a 24-hour hotline that the Alzheimer's Association fields with staff. And that is available to you any time of the night or day where maybe you're just having a bad day yourself and you need to talk to somebody who will be that, guiding light for you. So I would also say to anybody listening that's going through that, please put that number on your refrigerator so that you can get your questions answered by a live person who'll be able to help you.
Okay, Aishling, we have quite a few questions. Bill wanted to know, how do the medications that were listed work?
Well, that's another loaded question.
That's a long answer, perhaps.
Well, it's not really. The reality is there's no medication that can stop Alzheimer's. There just isn't. They have not come up with anything that is able to do that. Any of these medicines that I showed you are what they are using to try and preserve the dignity of the person, most especially this Aricept medicine. That's one that they give out right off the bat when they are listening to either the person or the family member who they believe has this dementia. And that kind of slows things down to where the person can continue a more dignified life by being able to form their sentences and, go about their day. I will say that I have taken care of people through, the end of life, sadly, with dementia, and they're still on Aricept. So again, we have quite a bit of work to do. Whilst it may work at the beginning, people in stage 3 should definitely not be taking that medicine anymore because it's, they're too advanced. So they try They do try to figure out what are the best medicines. And I would also say to anybody that's listening, if you have the ability to actually see a geriatrician, which is a doctor who specializes in geriatric care, that's always a good option as well, because they're very much up to date on newer medicines and newer things that are out there. And they'll also be able to tell you, based on the clinical trials, the medicines, even though they're older, that sometimes work better than some of the newer stuff. And again, it all depends where your person is at in the journey, the beginning, the middle, or where they're at in general. So I hope that helps.
Okay, Aishling, and another question. Is there a particular hospital or treatment facility that you recommend, or that is that specializes in treatment for dementia?
So we call them GPs in Ireland. Your primary physician, or again, a geriatrician would be the one, if you really wanted to go down the road of getting all of the answers and all the tests and all the specific diagnoses, you would have to see a neurologist. I mean, here in Chicago, I'm not sure where everybody is tuning in from, but Rush does wonderful work downtown. Northwestern does wonderful work. I mean, that's where a lot of the neurologists are doing a lot of their research. Mayo Clinic is phenomenal. So again, it would depend what you're looking for, and the best person to be able to kind of line the pathway for you, it would start with your primary physician. And if you can't get the answers from your primary physician, then I would definitely Google a neurologist in your area. And again, I will go back to this Dr. Daniel Amen, A-M-E-N. I have never met him. I study his work. He's phenomenal. He's called America's #1 neurologist because the work that he does and the processes that he uses in analyzing the brain is unbelievable, and he breaks it down to such a great level where people can understand. And he does even say in much of his talks that there is a way to prevent Alzheimer's. Now, some people believe that, some people don't. I personally choose to believe that there is such a thing as brain health, and he is big on the brain health. So you might look him up later. He's all over the United States. He has clinics in, I think, 7 or 8 different states, and he has one here in Chicago also. And his name is Dr. Daniel Amen, A-M-E-N.
Okay. Another question, Aishling, from Elena. Can kidney, liver, or thyroid problems cause memory problems?
The kidney and the liver, I'm not sure of, but yes, I can tell you that there is people who have issues with their thyroid. Again, Dr. Daniel Amen will tell you that that can cause problems later on. So the kidney part, I'm not sure about, but the thyroidism and thyroid issues, yes.
Okay.
It can.
Several people have asked this in different ways. Any way to prevent the onset of dementia or slow progression? What about nutrition hints, living environment, stress, and sleep, which I think you covered last week, the sleep and the stress and so forth?
So if you were to look up this Dr. Daniel Amen that I spoke about earlier, and actually today I just received another book that I bought called Awakening from Alzheimer's. It's by Peggy Sarlin. And this is a book about all of these innovative doctors that have gotten together in the United States, and they are talking about the ways to reverse Alzheimer's, dementia, and memory loss. And many of the stuff that I am reading and that I'm watching and that I'm learning is that, yes, sleep, Sleep deprivation does not help. Stress causes inflammation, which, as we talked about here this evening, the vascular dementia oftentimes is because the blood flow cannot get through to your brain because of swelling. A lot of the things that we eat, the toxins, are not good as well. So all of those things that you mentioned, in addition to that, we all live very hectic lives, and we do have a lot of stress and very little exercise. So back to what Dr. Daniel Amen is all about is the brain health. He suggests that what you're putting in your mouth is it good for your heart, or is it good for your brain? But sadly, for many of the folks that are my age and above, as I said last week, I'm 53, you can't prevent it at 75 because the damage sadly has already been done. So, you know, for the younger folks that are listening, when they tell us that these plaques and tangles begin years and years before the first presentations of the disease, the whole key here is, if you're leading an unhealthy life, to try and now start leading a healthier life, and definitely think about what you're putting in your mouth, because they do say there's a huge correlation to the gut-brain health. And if you can look up brain health, it's a very interesting topic. I would suggest doing that. And if you've had a horrible lifestyle, you know, just don't continue that lifestyle. I don't know if I shared with those that are listening that my mom had dementia. But just because she had it doesn't mean to say I'm going to get it. You know, the reality is that if I drank every night of the week, and I smoked, and I maybe, you know, didn't exercise at all and didn't eat well, then yes, my chances of getting it are way, way higher. So there's lots of different factors. It's not just one. So everything is a balance, basically, and we just need to be cognizant of everything that we're doing and make sure that we get our exercise, eat healthy, don't smoke, and have, you know, as Dr. Daniel Amen says, maybe 1 or 2 glasses of wine a week. That's it.
Okay. Aishling, so will you be talking about nutrition hints in future presentations?
So I believe we're going to be doing activities of daily living. We're going to talk about the dreaded end of life, which is so, so, so important. I know we're doing a piece on communication, which again is extremely important. But if this is something that is needed, I am sure that I can work with you all over at the library, and we can weave in, you know, a health piece into one of these presentations for sure.
That sounds wonderful. Okay, one more question and then a comment. I'll start with the comment. Jackie just mentioned that she took her mom to the Rush Memory Clinic for diagnosis.
Okay.
And then you go to your own doctors for treatment.
Right.
And then Elaine asks, are people who have Alzheimer's not given Namenda anymore?
No, that is still used. Namenda's a medication that is still being used.
Okay.
And some of the medications change. They change the name, but the components are still the same, or it might be that mixed with something else, and they might call it something else. But Namenda is still being used today.
Okay. And then last question here, because I know we're past time. Terry asks, is there a test for the other types of dementia?
Yes.
Okay.
Yes. So the Lewy bodies, for example, frontotemporal, yes. So that would all start at your primary physician's office. And when you, as the person who's going through these symptoms, which oftentimes it isn't those who are telling the doctor they're feeling all these things, very rare that happens. It's usually a family member is communicating to the doctor changes that they have seen over time, to where now they're alarmed or very concerned, and they go to the doctor, and then he or she will start the workup and send you to the necessary places based on what your advocate or your family member is telling to get that very formal diagnosis.
And that would go for the vascular as well, Aishling?
Well, vascular dementia, most often vascular dementia is usually comes after some form of a stroke or traumatic brain injury. Not everybody gets that form of dementia after a stroke, but it is very, very prevalent. So yes, your doctor would be able to talk to you about that also if you're seeing these significant changes, and he could certainly check those out for you.
Okay. Aishling, thank you so much. I'm sorry to keep you over
Oh,
time.
fine.
I've put my email in the chat box for anyone. You can contact me at the library. I'm Mary Lynn Maloney, and you can send an email to outreach@orlandparklibrary.org. If you have more questions, I can try and get you in touch with Aishling, pass on her phone number or email to you.
Yeah, I put it up there on the screen. And then just as a quiz, did anybody find out from last week when I tried to expand your brains and asked everybody what Gaurav Mahagat meant? Did anybody find it out? Or did anybody remember to look it up?
Does it mean good day to you?
It just means thank you in Gaelic.
Thank you. Okay.
That's all it means. It was a quiz question. Nobody did their homework.
All right. Thank you so much, Aishling. I appreciate it. And thank you to everyone for joining us. And we will also have this episode has been recorded and it will go up in the Orland Park Library YouTube channel. In probably early next week is when the marketing team can post it to our YouTube library. So again, thank you, everyone. And I think it's time we need to go. So good night.
Okay. Good night. God bless. Thanks, everybody, and have a great weekend.
Thank you. You too.
Bye-bye.